So medical surgical nursing 2, that is unit 2 of BSc nursing, third year, so which is from medical surgical unit. So the topic is nursing management of patient with eye disorders. So this is the syllabus for unit 2 BSc nursing, third year, medical surgical nursing. So nursing management of patient with disorders of eye. So usually glaucoma and cataract is very important. Others and all you can refer it. So it is the anatomy of.
We learnt that objects are visible because of the light getting reflected from their surfaces. This reflected light enters our eyes and we see that object. What happens inside the human eye when the light rays enter it? What is it that helps us see the things around us? The human eye is roughly spherical in shape. What we're going to do in this video is understand the different parts of the eye in short, not in extreme detail. Let's begin. The outer layer of the eye is called the cornea. It's white in color and transparent. Transparent? Yes, it means that it allows light to pass through it. In fact, cornea refracts or bends the light passing through it. And much of the refraction inside the eye is done by cornea. But wait, it not only refracts light but also protects the inner parts of the eye. It acts like a tough front wall of the eye, protecting the interior of the eye from accidents, and also does not allow foreign particles to enter. Okay, so this was all about the outer layer of the eye. Let's now talk about the things present inside. Behind the cornea, there's a dark muscular structure called the iris. Iris determines the color of the eye. For instance, when we say that a person has blue eyes, it means that the color of the iris of the person's eye is blue. Now there is a small opening at the center of the iris for the light to enter. Do you know what it's called? It's called the pupil. The iris actually acts like a shutter of a camera. It controls the amount of light entering the eye by enlarging or shrinking and thereby adjusting the size of the pupil. For example, when you focus the light from the torch directly into a person's eye, the iris shrinks. This is because the intensity of light is too much for the eyes to bear. The shrinking iris stops the unwanted light from entering through the pupil. And when there's less light, it expands, allowing more light to enter through the pupil. Okay, what happens next? The light that enters through the pupil falls on the lens kept behind. The lens is a convex lens. Convex lens is a lens which is thicker at the center than the edges. It's a converging lens. That is, it focuses all the light at one point. In a normal regular eye, this point is somewhere here on this inner boundary called retina. Why do I say a normal eye? Well, in a defective eye, this point of focus may lie either in front of the retina or behind the retina. We will talk about this defect of eye in our future videos, but first let's go back to our normal eye where light is focused on the retina. Retina is at the back of the eye and marks the inner layer of the eyeball. Retina contains lots of nerve cells that sense the light. The nerve cells are of two kinds, namely cones, which are sensitive to bright light, and rods, which are sensitive to dim light. The message or sensation is then transferred to the brain along the optic nerve. Okay, let's quickly recap what we learned about the human eye. Human eye has a roughly spherical shape. The outer part of an eye, called the cornea, is a thick white transparent wall which protects the eye from accidents and keeps the foreign particles from entering inside. Behind the cornea, the colorful part of the eye, called the iris, is present. It has a small opening at the center called pupil. Iris controls the light entering through the pupil by contracting and expanding. Behind the pupil, there is a converging lens which focuses the light on retina. Retina consists of two types of nerve cells, namely cones and rods. They transfer the message through the optic nerve. There is a lot of information to digest. In the next video, we will talk more about this lens present inside the eye and will also discuss its functioning.
Nursing assessment of eye. First, you need to assess external examination. Next, pupillary response. Third, functional examination. External examination, you need to note all these four components, that is redness around the eyes, discharge or crusting, or growths on the eyes or eyelids, excessive tearings, that is tears from the eyes. So in this pupillary reaction, you need to check what is pupillary reaction. So reaction to the light and near point reaction. In reaction to the light, you need to know, see the patient in an area with even lighting and instruct him to fix his gaze on the distant object. So with the help of this, you can know what is the reaction to the light of the pupil. Near point reaction. When the gaze is changed from the distant object to an object close at hand, the pupil should contract. Yes, you need to check on this. Is refractive errors. Myopia. Myopia is nothing but nearby objects are very clear, fine, and objects which are far away are not clear. So in this you can see nearsightedness. Myopia, nearsightedness means nearby objects are very clear, and objects which are placed far away are not clear. For example, what is written in the blackboard, by you are sitting in the last bench and you are not able to read what is written on the blackboard, so that is myopia, and you are able to read what is written in your book on the table. What is hypermetropia? Hyperopia is nothing but image which is very clear on the long distance, which is you will be able to read what is written on the blackboard, but you will not be able to read what is written on your books and notes. This is presbyopia, which is nothing but a gradual loss of your eyes ability to focus on nearby objects, so which will be occurring in your older age. Cataract, so the lens disorder. So in this you can see clouding of eyes. You see on the right side of eyes in this image there is cloud like sky color, right? So that is normally clear lens of eye. This is a clouding appearance, and this is obviously a little bit normal. So in this begins when protein in the eyes forms clumps that prevents the lens from sending clear image to the retina. C for clouding, you can remember clouding of eyes. So you can see another image here. We can see in the left side of the eye there is clouding appearance. What is glaucoma, which is very important in exam point of view, and cataract is also very important. I'll be taking another class, another session for that. What is glaucoma? Is an eye condition where damage of optic nerves is observed. This damage is often caused by an abnormally high pressure in the eyes, that is intraocular pressure, which should be normal. As the eye gradually deteriorates and there is a blind spot develops in your eyes, fine. So because of that there will be elevated eye pressure is due to a buildup of fluid. There is aqueous humor, so that flows throughout the eyes, inside your eyes, aqueous humor fluid in this eyes. You can see this is aqueous humor fluid. When the fluid is overproduced, more fluids is produced in this eyes, and there is some problem in the drainage of the fluid and the system that doesn't work properly. Two things can happen: overproduced, extra fluid produced, or maybe some problem in the drainage, that is excretion. For your knowledge I'm saying drainage, some functional problem might be there. So this is a healthy eye, you can see, and this is a glaucoma patient, and this is cataract. Cataract, as I said, there will be cloudy appearance, and in this glaucoma you can see there is damage to the eyes pupils, and there will be abnormally high intraocular pressure